This morning, we're taking a deeper dive into the mental health crisis because of the pandemic. 41% of people in a new CDC study say they are struggling with mental health right now. Many saying they have depression, started taking drugs, or have even thought about suicide. I'm joined this morning by Dr. Patrick Runnels, the Program Director of Public Psychiatry at University Hospital's Cleveland Medical Center. Dr. Runnels, thank you so much for joining us this morning.
You're very welcome, and thank you for having me.
Well, let's talk about what we're hearing this morning about the mental health crisis and how it is impacting communities of color. What are some of the barriers that are in place that probably a person of color would not want to seek help for their mental health issue?
So there's a lot of trouble with how we have access to mental health services. The first is that we don't have as many people doing mental health, and access because of staffing it has been a major problem for many, many years. And so the distribution of services isn't where we'd like it. It's not easy to find the right person. Add to that there's a lot of stigma against mental health and mental illness for a lot of people, and particularly for communities, Black communities, that can be a really big barrier. People were worried about how they might be perceived and how people might perceive them if they have mental illness. And so that can be a really big challenge as well.
Another thing we talked about on our podcast yesterday is that there is an issue with someone sitting across from you that doesn't look like you, trying to give you advice on how to handle your emotions and your mental health.
That's right. So the population of people who provide mental health, the providers, don't reflect the diversity of our nation nearly as much as we ought to. That's a problem we've had in our field that we've woken up to, particularly over the last several years. And that's something we need to fix. But we have a lot of research to show that the people that get the best results in terms of engagement are those that are from a similar culture or a similar background from you. And we just don't have that in psychiatry now, particularly for Black communities.
We do have research that says that depression affects more women than men. Why is that?
So there are a lot of people have a lot of thoughts, but you could think about women and men have different physiology. There are, and so certainly our chemistries are slightly different. However, the experience that women have in the life, the types of challenges they face in life are also different. And I believe it's fair to say that women, those different experiences are likely the main driver of what's going on. But just to be clear, we don't have great research to show exactly what's different. And so those are the two things we think about.
And before we let you go, quickly, can you talk about the impact Kevin Love, Cleveland Cavaliers, talked about his mental health, and now former First Lady Michelle Obama has announced that she has low-grade depression. What's the impact those announcements will have on the industry, on mental health?
The impact is huge. So for millennia, mental health has carried just tremendous stigma. When someone like Kevin Love comes out, who has a really strong national presence and is really thought well of, and tells the world that he's going through anxiety, which is the disorder he was talking about, then it helps everyone else feel a little more okay about their own issues. Same thing with Michelle Obama. And as the people come out and they have this really huge national profile, but then they also are themselves diverse and come from different backgrounds, it goes a long way to showing what we know, which is that many, many people experience mental health issues in their life. It's a very common occurrence. And while it's not normal to feel terrible, it's really common to go through this experience. And the more you see other people, particularly of note, having those troubles, the more okay it feels for me to both experience it and then go seek help.
And go seeking help is what we want everyone to do. Thank you so much, Dr. Patrick Runnels. We appreciate your insight this morning. And you can hear much more in-depth conversation with Dr. Runnels about all of this by listening to my podcast. He's one of my guests on Voices for Change this week, Pressing Through Depression. Check it out on the News 5 app, Spotify, or Apple Podcasts, or join us after Good Morning Cleveland on our Facebook page.